have to stop and then we'll do another one, another migration.
Okay.
Yeah.
Thank you. Okay, over to you, Thibault.
Yeah, so hi everybody. I'm Thibault from BlueSquare, and we work with 2M Corp on the Gambian implementation. So I'm going to show you the Grievance module that 2M Corp produced. So you have some fields here for filtering out the tickets, just like you have in all the pages in openIMIS. But if I want to create a new ticket, first I'm trying to find somebody. I guess there must be someone called test. Maybe not. So I will take an existing nin. So that's the one. You select a date. Let's say it happened today. You can put here witness. So I guess you could send an anonymous grievance because you don't want to have any repercussions, or you could say, hey, I'm the one who had a problem, so you can write down the name of the person concerned. Then you have some categories. Here there's just one, so it's related to a claim, but we can imagine that there could be grievances with other topics. You select a priority for the ticket, because some grievances will have a higher priority than others, and then you enter the description, everything that happens. You can type whatever you want, and then you save. Once you do that, you simply have a new entry in your list of tickets, and you can enter any open ticket. As you can see here, there might be some attachments, so you can upload a file. If you had any problem with the claim, you can upload the PDF for that claim, for instance. And then here you have a resolution field where you can say, oh, we understand there was an issue. We are going to contact the health facility. You write down this, and then you save it. And then I guess that the ticket is closed. So that's it. Maybe if you have anything more to add, Yolande, you can add it. I didn't go further than that with the module.
So yes, that's basically the Grievance module that we implemented with the Square.
Thank you very much. Thank you, Thibault, for quickly jumping in for that quick demo.
You're welcome.
I think that really helps get an idea of the work that has been done, and yeah, hopefully we can integrate it into the main branch and have this as standard functionality as well. So
yes, definitely. I already provided the links, and I think that the repositories were already forked, so it will soon be part of the main branch, I think. I don't know if anybody's interested, but as long as we are here talking about the Gambia, I can show you a few more things. I was not on the agenda, but if we have some time and you're interested, I can show you. Otherwise, we can leave it at that.
We still have time, yeah.
Yeah, we still have time, and unless there are other questions to Nigeria, we could take them first, and then we could hand over to you, Thibault.
Sure.
Anything else on the Nigeria implementation from anyone? If not, then the floor is yours, Thibault. And I was about to ask about the new menu items that you have there anyway. So if you could take us through the Gambia implementation, that would also be very nice. Thank you.
I'm going to do this. Let me share my screen again. So you have a keen eye, sort of. You noticed the menu.
Yes.
So yeah, I will start with this. So in the Gambia, we have a national insurance program. Basically, the whole population should be registered on a national registry, and the reference data, the population data, and the location data comes from that registry. So we integrated the registry. It works with subscriptions. So basically, you say openIMIS wants to subscribe to a specific topic to receive information on population data or on location data. Once you are registered, whenever there's a change in the registry, something is created, something is updated, or something is deleted, we receive a notification from the registry, and then we can process the notification. So here's some examples of notifications that we receive. And then the page here is just for showing what happens if the information was properly processed, or if there was an error of some sort at some point. So whenever something happens in the registry, it ends up on openIMIS. And for instance, if somebody goes to a hospital and they are not registered yet, first, instead of enrolling directly into openIMIS, they should register themselves
Sí,
at the desk.
Alexander. Sí, vet inte på honom mer. Har ett business me pute. Ora shikoj këtu ke village
Sorry,
ky
I think
shafi
there's
elektrik
someone with the
shizim nga
mic
kabel.
open. Okay.
Okay, I thought it was a question. So
Yeah, I did too.
the patients need to first register on the national registry, and then it should be nearly immediate. We receive the information, and then we get all their data in, and they can start having some claims. Some people don't have to pay in this program, for instance, pregnant women or elderly people, but others will need to pay some contributions to have healthcare. So I don't have anything to show you here, but we are preparing mobile money payments with a local payment provider. There were a few issues with the provider API, so nothing is prepared yet. But we are working on it, and hopefully it will be ready soon, and we'll show you that once it's done. Then maybe the final thing I can show you here for the Gambia, the NHIA, so the Ministry of Health, wanted to have some dashboards for their instance. So we prepared a dashboard on Superset. You can see here various types of charts. It's linked to a copy of the test instance that we have here. So it's not the direct data. And on the various charts, you have some options here. For instance, here you have the regions. And if, let's say, you want to have the information only from people who are in that region, you just click on it. Then all the other charts will be filtered again. And then it will display only the information for people on that region. But then you can continue. For instance, here you have things about diagnosis and claims. If I want to have all the information only for people in that region and people who had claims with that diagnosis, you just click on it and then you go on and on and on. So that's it.
Thanks, Thibault. Yeah, very interesting to see another dashboarding solution as well. We saw, well, we have the work with DHIS2, we've seen Metabase, and I think this is the third with Superset. But yeah, I think if that works, it's all the merrier. No, it's another way to visualize data. We'll have to start keeping track of all these different solutions so that people see that there's there's the OpenSearch integration. Sorry.
There's a lot of integrations. I think there was some deep dives about that.
Yep. So glad to see this as well, so that clients basically have various options to choose from. So I think that really shows the power of open source. There's a question on the grievance module that you had presented before from Anna. Is it just for